life. And many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma.
A very good afternoon to all of you in this live interactive session of ours. It was really absorbing interaction with all of you here at Singapore, and it's now fast cruising towards the time when I have to move to my next upcoming meet. So I'll try to go live tomorrow also, because there have been a lot of pending questions from many of you which remained unanswered due to the last few days of excessive busy curriculum with the patient meets and everything. So I will be trying to compensate all of those through today and tomorrow by speaking to the maximum of you. And when we talk about Ayurveda, when we talk about the right kind of Ayurveda, what is really very important for us to realize is that Ayurveda in no way means taking certain herbs, starting those herbs, and trying herbs on yourselves, thinking that the herbs will alleviate diseases. People say that yes, Ayurveda is without any side effects. It is. But for that to remain without side effects, it becomes very important that Ayurveda is being taken under a qualified doctor, a doctor who knows how to use, what to use, where to use. Not every herb is meant for everyone. Not every herb is meant to be taken at any specific time. Not every herb is meant to be taken throughout the life. I come across the shelves when I travel in all these countries, and I see there are so many herbs which people are taking regularly. What becomes very important for us to realize is that Ayurveda has specifically categorized certain Rasayana herbs which Ayurveda feels can be taken throughout or for a very long time frame. Even in those Rasayanas, many a times Ayurveda has laid down the norms for using specific Rasayanas in summer season, different Rasayanas in Varsha Ritu, that is the rainy season, separate Rasayanas in the winters. So Ayurveda never says that carry on taking the same kind of herb long and long without any reason. If you are carrying on with the herb, either it will stop giving you results, or in case of some herbs it may start showing some agonizing effects also. So it becomes very important what herbs are being taken, and such is the beauty of Ayurveda, that it's not just the herb which is being taken but also the anupan. When we say anupan, we mean to say what is being taken with that herb. For example, Ritu Haritaki, Abhya. When we talk about Harad, that is Haritaki, that is Abhya. Now, that is one of the best Ayurvedic Rasayanas. It is being used around the globe in the treatment of fatty liver, in the treatment of chronic constipation. But again, when Ayurveda doctrines the use of that Abhya also, it tells you to use Abhya, that is Haritaki, with separate anupanas in separate seasons. There is a specific video of mine on my channel where it is mentioned when and with what thing to take this Abhya. So that is why it becomes very important that we know Ayurveda, we understand Ayurveda, and we use Ayurveda to the right kind of ways. So before I move further, I will be going into the depth of Ayurveda, and all of you are welcome to take your questions. I'll be taking a short break from you for only a few minutes from here. I'll be back with you. Stay tuned. Over to a small break.
Hello friends, greetings. I am the Great Kali. If you also want to stay fit like me, then you should try Wrist Pushed, and my trust has been strengthened by Dr. Navdeep Sharma. Just as I have defeated wrestlers and made India's name ring out across the world, in the same way, Dr. Navdeep Sharma's Wrist Pushed Ayurveda has driven away every disease. Once again, the flag of good health has been raised high. Hello.
So, welcome back after the break. Once again, I am there with you, and that was the great Kali endorsing Naresh Push products, endorsing our Ayurveda. And such is the beauty of our Ayurveda that those who really care for their health believe on being with us, because at ND Care, we never believe in selling you herbs. We believe in guiding the true Ayurveda to you. We believe in guiding the Vata, Pitta, Kapha to you. And if you really want to stay healthy, it again becomes very important for you to understand what is your body type. God has blessed us all with different body types. Vata body type, Pitta body type, Kapha body type, and it becomes so much important for all of us to realize which is our exact body type to be able to be living healthy. It is so important. We all know our blood groups. If I ask someone what is your blood group, the answer is pretty quick. Most of us know what our blood group is, and there is no harm in knowing the blood group. After all, if we know our blood group, in case of emergency, that is really going to help us. So it's good to be prepared for emergencies. But what about the day-to-day life? If we care about what to be done in emergencies, it becomes so very important that we also understand about what to be taken right from the time we take our first breath to the time till our last breath, which is specifically there for our body type, which will keep us more healthier. So there's a separate body video of mine on my YouTube channel on know your body type, and time and again we keep on having webinars where we try to guide you up about the body type which you are having, where we try to guide you about what kind of body constituency you have and what is good for you as far as that body type is concerned. I'll just quote an example over here. If a Vata body type person, a person who is having a Vata body type, is not taking a small nap in the afternoon, somewhere in the life, the Vata body type is prone to have arthritis or Parkinsonism or neurological problems. Now, that is something which will happen when someone will be having a body type which is Vata body type, and still the person is not taking rest properly. Now come to the Pitta body type. If a Pitta body type is consuming too many dry fruits or is taking too many things which are of hot constituency, the person is going to have liver disorders, the person can have then biliary problems, the person may develop skin rashes and skin problems. So it becomes so much important that if you are having a Pitta body type, you take more of cooling things which nature has blessed us with. And again, when we talk about the Kapha body type, now Kapha body type is a body type where it becomes so very important for us, so very important that the person is not taking a nap during the daytime. Now, Kapha body type is more chronic, more prone to diseases like diabetes, hypothyroidism, high cholesterol level, obesity. These are the kind of diseases which a Kapha body type generally is more prone to. So, if your body type is Kapha, and even when you are in your young age, you start to have a life according to your body type, you in the coming age can prevent the occurrence of such diseases over here. So going ahead, there are multiple questions which I can see over here. I'll try to get to some of those questions. Like for example, I am having a question from Satyam Rawatji. So how to contact you and get appointment? Satyamji, you can contact on the helpline numbers, and they can then check the curriculum where I am going to be for the next OPD curriculum or the next meet curriculum. And yes, definitely through that we can connect. And currently it's the last few days in Singapore, and it was a nice interaction with people over here. So, and the upcoming ones, if I talk about the international curriculums, they are for Canada and they are for UK. you can get back to the team for those also. And yes, there will be 2 OPDs during the short span of time over there in India also. So those of you in India, definitely we can connect over there. One shall be at Chandigarh, which will be after Deepavali, and one will be at Amritsar, which will be before Deepavali. So yes, you can be over there interacting with the team for those. And going further ahead, there is a question from Mr. KK where you are asking about my wife diagnosed with lupus SLE. So when we talk about SLE and when we talk about systemic lupus erythematosus, it again is a disease which is known as Amaj Vyadhi in Ayurveda. So in cases of lupus, see, if we talk about the allopathic pathogenesis, yes, definitely the allopathic pathogenesis will be the same for all lupus patients. But if I talk about Ayurveda, it becomes very important to understand that if someone is having a lupus erythematosus, if someone is having a butterfly rash around and is having joints pain and is having other problems, now it becomes very important to understand why. What exactly is the underlying reason, Vata, Pitta or Kapha. As I just mentioned to you a few minutes prior also, that if we really want to go to the reason of a disease, if we really want that someone is suffering from a chronic disease where we really want to bring the person out of the disease, the beauty of Ayurveda is that yes, it can bring the person out of disease, but in such cases, yes, the supplements can help. We can always guide you with some supplements sitting at your own home. You can take those. But if we really want a person to come out of this SLE, Nadi Parikshan, that is pulse diagnosis, and then body detoxification. That is something which really works a lot, and that is something which really becomes so very important for a person to follow. So coming to autism now, many of you are having questions in regards of autism, and when we talk about autism, uh, even here in Singapore, there are so many children who are suffering from autism, and the number of cases for autism are on a rise around the globe. So when we talk about autism, I always say that autism is a temporary phase in the life of a child if it is treated timely. So it becomes very important that if a child is suffering from autism, the first bold step which the parents are to take is that they need to believe that yes, our child can come out of autism. The biggest problem which I see with autistic children coming out of autism is that the parents themselves don't believe that the child can come out of autism. With so many of allopathic psychologists, neurologists, pediatricians, which they have already met. Now, when they meet various pediatricians, when they meet various psychologists, when they meet various therapists, the biggest problem which we face over there is that most of them have not seen any autistic kid coming out of autism. And that is why they tell the parents the same thing, that see, your child is autistic, is not going to come out of autism. You have to cope up with the condition, and you just need to ensure that the child becomes self-sufficient. Now that is where the problem starts, because the target which they fix is making the child self-sufficient, and that is why they work accordingly. They develop a sign language in the child, they try to improve the eye contact of the child, they try to do occupational therapy where they will do a lot of commands for the child. And I won't say that these things are not important, but the thing is that none of these things is going to bring the child out of autism. So if we really want the child to make the journey out of autism possible, we need to be following the guidelines of someone like us, who has done it for so many kids and who know what to be done. And that is why when the parents they meet me, I always try to guide the parents. I come on lives, I guide the parents. And why parent guidance is so much important is that I always say in most of my lives, the best psychologist for a child is the parent himself or herself, and the best themselves. So if someone can bring your children out of autism through their dedication, They are you yourselves, at the most grandparents or someone who is living with the child. Don't expect the psychotherapists independently without your support to bring the child out of autism. So that's why when the parents visit us, there are two kinds of parents who visit us. One category of parents, they visit us for 21 days to a month's time, and that is for the training purposes. They come to us, they stay at our center, we train them up for how to interact with their children. And when we work on them, they really realize that, yeah, these were the things which we had been doing in the wrong way for so many years. So they realize that now that is the right way. This is how we need to be interacting with our children. And when they learn it, then they go back to their homes, and then our team works in tandem with them through video conferencing sessions, as a result of which gradually the child develops language, develops socialization, the sensory issues and stimming issues come down, and a child comes out of autism. There is another category of parents too, and that again is a huge category of patients in the second category. Now, these are those parents where the parents feel that it is tough for us to work on our children. Now, that is although that is something which I don't appreciate, but I understand that in various parts of the globe, the family support system is not as great as in the Indian subcontinent. And again, when I talk about the Indian subcontinent also nowadays, in the metros, people are living independently with less domestic support. So as a result of that, what I guide the parents over there is, don't wait. Don't wait for your child to get older, because the younger the child, the easier it is for us. So that's why over there, I always guide the parents, leave everything aside. There is nothing more important than your child being out of autism. There is nothing more important than your child being a normal child. And believe me, if I travel around the globe, if people around the globe, they meet me, they come to us, they stay there in India, they stay for 5, 5, 6 months, they stay for a year in some cases. If they leave everything aside for their children, why can't that be done by us? It is very important, because as the child will keep on growing in his or her age, the things are not going to become easier. The things are going to become tougher. And specifically in India, where we are NABH certified and we are on the panel of most of the insurance companies, and at the same time being NABH certified and being having the international quality standards and having our own organization registered in US, NDCare US, then in Canada and in various parts of the globe, many of the international companies also will provide claims later on for the treatment. I won't be able to comment it for all the companies, because a lot depends on which company you choose, what kind of plan you took. We from our end are capable of providing you all the documentation. But again, even if you are not covered under insurance claims, I don't feel a few lakhs of rupees are more important than the life of a child. Because even if we go in a good hotel today for an outing, we spend so much. But if we are going to spend for our child, it becomes more important for anything else in the life. Because what happens is, even when we use the herbs, when we guide the parents to be using those herbs, now those herbs, they will bring the child to a better concentration span, to less aggression, to a better cognition, to a better understanding, to a better positive phase of mind, from where the parents then can carry it forward through the therapies. Because if those changes in the child are not worked in tandem through the ABA, through the therapies, because after all, what do we want? We want behavior change coming in the form of better communication, better socialization, better sitting tolerance, less of tantrums. Now that is what we want in our children, and in some cases we need a better toilet training. So when we want changes in the behavior pattern, we can expect changes in those behavior patterns once we work on the behavior. And yes, the herbs, they do work on the behavior of your child, but a lot of the things have to come through the trainings, through the ABA, which we guide. So without ABA, the treatment is incomplete. And again, when we talk about ABA, it is not the normal ABA which is done around the globe. It is the specific ABA curriculum which I myself developed. It took me more than 15 years of time. At 24 years of practice, since past 15 years, I've been working through psychotherapy primarily and focusing a lot on psychotherapy. So if the first 10 years of my life was a research on herbs, after that it has been psychotherapy, and since past 3-4 years the results have been so great working in tandem with both of them. Although when I was using Ayurveda, I got good results. When I was using psychotherapy, it was good. But the amalgamation of Ayurveda and psychotherapy in a scientific way, that is brilliant. That is really brilliant for your child. And believe me, that is not being done anywhere else in the globe. And that is why when I ask parents to come to us, when I ask the parents to leave everything apart, and when we ask the parents to take out their time, the results are miraculous. That is why we ask the parents to spend the valuable time for them. Now, going further, and Kamlesh, you are from Himachal and you have updated that your wife is diagnosed with SLE, and as I just requested, a Nadi Parikshan is very good for her. You can get back to the team for that. आप नाड़ी परीक्षण के लिए नब्ज दिखाने के लिए टीम के साथ बात करें, वो बहुत ज़रूरी है SLE से बाहर निकालने के लिए. And coming further, the next question is from Mr. Samay. जी, Mr. Samay, when we talk about the Chandigarh Panchkarma Center, which many feel is a bit expensive, yes, it is. That is why we have a second option for the parents. Now, that is a very economical option. There, they do not stay with us. They stay at various hotels or in various temples or gurdwaras over there, depending upon their affordability, in the holy city of Amritsar. And the daily travel in the morning from that place of where they are staying to our Amritsar center, get the therapies and the psychotherapy done throughout the day, and they leave back in the evening to the place where they were staying. And Amritsar center, yes, definitely, there's a lot of difference in the things which are done at Amritsar center and at the Chandigarh center. But then people do get well, children get out of autism at Amritsar center equally. So if you feel that cost is something which is coming in your way in getting your child's treatment for autism with us, staying with us, the best method over there is, rather than Chandigarh center, you can choose the Amritsar center for that. That should not be a problem if there is a financial concern, because as I always guide all my parents that Ayurveda is meant for all. Ayurveda is not just meant for the rich or the middle class or the poor. That is why we here at NDK Nirogam Private Limited believe that the good Ayurveda, every one out of you has equal rights on Ayurveda, be it the richest of rich. Now, when we talk about the richest of rich, we ensure that when they are taking treatment from us, when they are staying with us, they get the same luxurious feel which they get in any luxurious setting of place in a hotel or something. The therapies which are done keeping in mind the finest quality standards which a person can get in any 5-star spa. Now, that is what we do for those who can afford it. For those who want a treatment which may be less luxurious, which may be less in the hospitality, but the results should be good. That is what we do for the middle class. And for those who don't want hospitality, who don't want comfort, and who are having financial concerns, who only want results, that is where we have the Amritsar Charitable Center. So we have good Ayurveda, we have good Panchakarma, we have good psychotherapy, we have good Nadi Parikshan, everything for each and everyone on this earth, because we believe that Ayurveda being the best science, cost should not be a hindrance. in going for quality Ayurveda, I really don't want people to be falling in the hand of quacks. There are so many quacks in Ayurveda. There is so much of quackery in Ayurveda. There are so many less qualified consultants in Ayurveda. Always check out for the degrees of your consultant. When I talk about degrees, the basic degree for any consultant to practice Ayurveda as per Indian government laws is BAMS, Bachelor's in Ayurvedic Medicine and Surgery. Above that, it can be MD, it can be MSc, it can be MS, a master's degree. Like in my case and in the case of many of my team members. Above that can be a PhD, which is the highest degree. And in rare cases, like in case of senior consultants like me, a DLIT. I am a DLIT scholar myself. DLIT comes after PhD. So it's a super research, it's a super doctorate, and that also. So always check for the degrees of your doctor. So if your doctor is well qualified, he is working hard for the patients, you will always get quality results of Ayurveda. If you do not look at that, if you just look at what someone is claiming, that is not going to work. It may work at some times, it may cause a lot of problems on the other times. So that is why it becomes so very important that we choose the right doctor, we choose the right kind of Ayurvedic treatment, and once both of those are done, believe me, we can defeat any major disease in a scientific way. So, today it will be the last question for me now before I take a break from you, and as it's a hectic curriculum today over here and in Singapore, and sir, मेरे हस्बैंड को CKD बताया है बट कोई प्रॉब्लम नहीं है, क्या वो ठीक हो सकते हैं? वो कहते हैं रिवर्स नहीं होता। अर्चना जी बिल्कुल भी चिंता मत लगाएं, अगर CKD बताया गया है सबसे पहले कारण जानना जरूरी है। क्या कारण है, क्यों CKD बताया गया है? CKD कई कारणों से हो सकता है। अपना अल्ट्रासाउंड स्कैन रिपोर्ट्स डिटेल्स जरूर शेयर करें। आप में से जो लोग भी किडनी डिजीज से जूझ रहे हैं, मेरी हमेशा विनती है, कारण जानना बहुत जरूरी है। कोशिश किया कीजिए, जहां ट्रैवलिंग पॉसिबल नहीं है वहां वीडियो कॉन्फ्रेंसिंग के थ्रू, और जहां ट्रैवलिंग पॉसिबल है वहां नाड़ी परीक्षण हमें कभी भी मिस नहीं करना। और आप चिंता मत लगाएं, रिवर्सल संभव है कारण जानने के बाद। वो कारण जानना बहुत ही अधिक जरूरी हो जाता है। So before I take a break from all of you, I would be leaving you with a small video, and I'll be trying if I can make a small interaction possible with you, all of you, tomorrow on the promised specified Wednesday timings. Since it is a bit hectic on Wednesday, I tried I should be going live today, so I will definitely try to make it possible tomorrow, but it won't be a promise. So I hope I was able to provide you the answers to all of your questions. So bye bye currently from my end. Stay healthy, stay wrist pushed. Bye bye.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding. The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
करो
आ जाएगा वो।
कलर करो, वेरी गुड पार्थ, कलर करो। नो, इस हैंड से कर, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा का हैंड, दीदी का हैंड पकड़ो, हैंड चलो, वेरी गुड, खाओ, वेरी गुड। हेलो पेरेंट्स, पार्थ हेलो करो, हेलो करो। ये पार्थ है मेरा बेटा, 4 साल का होने वाला है। लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे। हमें एक सर ने मेरे बताया था सर के बारे में। हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ
मम्मा पापा हमसे बोलेगा इतनी जल्दी। हम तो मतलब बड़ा एक माँ पेरेंट्स के लिए एक रहता है कि कब हम मम्मा पापा सुनेंगे पार्थ के मुंह से। आज पार्थ मम्मा पापा और विद सेंस सब कुछ बोलता है भगवान की कृपा से और सर की मेडिसिन और सर के गाइडेंस से। आज 9 महीने में पार्थ एक नियर टू नॉर्मल लाइफ जी रहा है। और स्कूल में भी पार्थ प्ले ग्रुप में था। अभी जस्ट 15 दिन पहले ही स्कूल में मैम ने बोला कि पार्थ को हम नर्सरी में भेजेंगे। और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए, एक पेरेंट्स के लिए बहुत बड़ी बात है। थैंक यू सर, थैंक यू वेरी मच हमारी लाइफ में इतनी बड़ी खुशियाँ देने के लिए। थैंक यू एंडी निरोगम।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Vivan, age 4.5 years old, disease autism. Chief complaints: speech delay, less understanding ability, inexpressive, sensory issues, lack of focus. The parents of the child consulted Dr. Navdeep Sharma on 27th November 2022 at 11 AM and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write, and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class and also understand things in a better way.
हाय, मेरा नाम प्रिया है एंड मेरा बेटा है 5 साल का होने वाला है एंड मुझे नवदीप सर से मेडिसिन लेते हुए मोर देन 1 ईयर हो गया है एंड आई हैव चेंज लाइक आई हैव सीन इमेंस चेंज इन माय सन। लाइक जब हम यहाँ पे आए थे तो ही वॉज लाइक वो एक एक वर्ड ही बोलता था एंड जब से हमने मेडिसिन शुरू की है एंड मेडिसिन के साथ साथ शिरोधारा भी इसकी मोर देन 1 ईयर से चल रही है एंड विद कंटिन्यूटी ऑफ दिस मेडिसिन एंड ऑल उसमें ड्रास्टिक चेंज है। जैसे अभी वो सब कुछ अपनी चीज़ें 99% अपनी चीज़ें वो बता पाता है ईजिली एंड दैट टू वे स्टार्टेड मेकिंग फुल सेंटेंसेज ऑल्सो। क्लास में भी अकेडमिकली ही इज़ गोइंग सुपरबली ऑसम। ही हैज़ स्कोर्ड 88% इन हिज लास्ट टर्म एंड जहाँ पे जब वो नर्सरी में था ही जस्ट स्कोर्ड 55%, नॉट इवन 50%। एंड अभी जस्ट टर्म ए में ही इज़ इन जूनियर केजी। अभी टर्म ए में उसके 88% नंबर आए हैं। नाउ ही हैज स्टार्टेड राइटिंग ऑल्सो। पहले वो मतलब पकड़ के लिखता था, पेंसिल पकड़ के, उसका ग्रिप भी प्रॉपर नहीं था बट अब वो लिखने भी लग गया है। प्लस मुझे जो मेडिसिन से जो मुझे मेन फ़र्क दिखा है दैट इज़ सेंस, जो मुझे चाहिए था कि सेंस में थोड़ी सी डेवलपमेंट। पहले उसको फ़र्क ही नहीं पड़ता था कि कोई घर में आ रहा है जा रहा है, वो जस्ट कमांड वाइज ही चल रहा था। लाइक ही स्टार्टेड फॉलोइंग माई कमांड्स, लेकिन अपने दिमाग से वो कुछ नहीं कर रहा था। बट जब से मेडिसिन लेना शुरू किया आफ्टर 3 मंथ्स मुझे ज़्यादा चेंजेस दिखे हैं। 3 मंथ्स में धीरे धीरे चेंज आए। अब विद इन अ ईयर तो ड्रास्टिक चेंज है। जैसे उसको देख के आप बोल ही नहीं सकते हो कि दैट ही हैड माइल्ड ऑटिज्म, तो उसको माइल्ड ऑटिज्म ही था बट अब वो माइल्ड ऑटिज्म के स्पेक्ट्रम से भी निकल गया। अब जस्ट उसके थोड़े थोड़े सिम्टम्स रह गए हैं एंड वी आर स्टिल इन टच विद नवदीप सर। वी आर स्टिल टेकिंग द मेडिसिन। उनकी जो भी गाइडलाइंस है, बीट डायट, बीट उनका यंत्र, वी आर डूइंग दैट रिलीजियसली एंड आई मीन इट। विद दैट हम उनको हीलिंग म्यूजिक भी सिखाते हैं जिससे बच्चा इंटरनली भी हील होता है। मेडिसिन हम दे रहे हैं। सो आई एम क्वाइट हैप्पी विद दी मेडिसिन एंड फैसिलिटीज। द डॉक्टर्स आर एवरी टाइम अवेलेबल और मुझे हफ्ते में 1 साल से ज़्यादा हो गया, मुझे हफ्ते में 1 कॉल ज़रूर आता है यहाँ से दैट यू नो वेदर द थिंग्स आर गोइंग राइट। विवान के बारे में दे आस्क कि वो कैसा चल रहा है। तो लाइक दे आर इन टच, द होल टीम इज़ इन टच विद मी मोर देन 1 ईयर। मेडिसिन यहाँ पे टाइम से आ रही है, हमें घर पे डिलीवरी मिल जाती है। जब हमें आना होता है नवदीप सर के हमें कॉल्स आ जाते हैं दैट यू नो वो अवेलेबल है इफ़ यू वांट टू मीट। तो द एज अ क्रक्स आई एम सेटिस्फाइड विद द मेडिसिन ऑल्सो एंड विद द स्टाफ ऑल्सो। थैंक यू।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Bhanu Pratap, age 6.7 years old, disease autism. Chief complaints: hyperactivity, speech delay, communication, short sitting, problem with understanding. The parents of the child consulted Dr. Navdeep Sharma on 2nd November 2022 at 11 AM and felt the scope of treatment to work for the child. The chief complaints of the parents of the child were hyperactivity, speech delay and short periods of sitting. The child also did not communicate much. Within a year of treatment from ND Care, a significant improvement was witnessed in the child. His condition showed positive results with reduced hyperactivity, improved speech, better understanding and longer sitting. He even communicated and expressed his feelings in detail. Participation amongst peers has also increased. The child also participated actively in the school activities and showcased confidence.
बच्चे का ट्रीटमेंट हमारा चल रहा है तो हमारे बच्चे की बहुत अच्छी इम्प्रूवमेंट है। पहले तो हमारा बच्चा बात भी नहीं करता था, कोई समझता नहीं था, अब इसमें स्पीच भी आई है, अंडरस्टैंडिंग आई है जी। अभी मतलब बैठ जाता है, पहले 10 मिनट भी बैठता था, तो काफ़ी इम्प्रूवमेंट हुई है बच्चे में, पहले कुछ भी नहीं था। तो सारी हमारी भगवान है, मतलब पहले हमें पता भी नहीं था, सरकार को पता होता तो हम पहले से ट्रीटमेंट स्टार्ट कर देते, तो हम खुश हैं अपने बच्चे के लिए।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Ritika, age 20 years old, disease autism. Chief complaints: hyperactivity, behavioral issues, shouting and screaming, irritation. The parents of the child consulted Dr. Navdeep Sharma on 23rd January 2023 at 3:00 p.m. and felt the scope of treatment to work for the child. Before the treatment, the chief complaints were regarding hyperactivity, shouting and behavioral issues. She screamed abruptly and showed irritative behavior frequently. With the ongoing treatment, significant improvement was there in her condition. Hyperactivity was reduced a lot. She also became more calm and also stopped shouting. Along with that, irritative behavior also showed improvement. She also got involved in co-curricular activities like sketching and painting, which improved her performance. She also showed a lot of growth in terms of expressing herself. She started singing and other activities.
हम रणजीत सेन हैं। माई डॉटर का नेम है रितिका सेन। शी इज़ एन ऑटिस्टिक पेशेंट। 1 साल पहले गूगल में डॉक्टर नवदीप शर्मा को देखा, उनका साइट देखा, तो उसके बाद हमने कांटेक्ट किया है और 2023 जनवरी से हम मेडिसिन ले रहा है अंडर सुपरविजन डॉक्टर नवदीप शर्मा। 9 महीने में हमको बहुत ही असर मिला वो मेडिसिन से। पहले शुरू में मेरा बच्चा चीखते थे, हर टाइम अचानक चीखते थे, हर टाइम चिड़चिड़ापन रहते थे, हाइपर था, बहुत ही हाइपर था। मेडिसिन लेने के बाद उसका ये चिड़चिड़ापन, एग्रेशन बहुत ही कम गया है। मेडिसिन के साथ साथ पंचकर्मा भी दिया है और साथ में साइकोथेरापी भी चल रहे थे। तो ये साइकोथेरापी, पंचकर्मा और मेडिसिन लाके कुल मिला के मेरा बच्चा अभी बहुत ही बेटर है, पहले से बहुत ही बेटर है। आयुर्वेद में हमको लगता है डॉक्टर नवदीप शर्मा स्पेशली फॉर ऑटिज्म के लिए बहुत ही अच्छा डॉक्टर है। थैंक यू।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Hiravraj Singh Tomar, age 4.5 years old, disease autism. Chief complaints: speech delay, hyperactivity, poor eye contact, less social interaction, low attention span. The parents of the child consulted Dr. Navdeep Sharma on 10th August 2023 at 10:00 a.m. and felt the scope of treatment to work for the child. The child was diagnosed with autism spectrum disorder, which caused the issues of hyperactivity, social interaction and speech delay for the child. With the onset of treatment, the results started showing up. There was an improvement in hyperactivity and increased social interaction.
मेरे बेटे का नाम हीरावराज सिंह तोमर है। हम लोग भोपाल से आए हैं। मेरा बेटा जब 3.5 साल का था तब उसको डायग्नोस हुआ था ऑटिज्म। फिर मैं रेगुलर रिसर्च करती रहती थी गूगल में। फिर मैंने एक बार यहाँ रिस्ट बूस्ट का और एंटी केयर के बारे में सर्च किया, तो यहाँ पे पूरे कॉन्फिडेंटली सर ने बोला है कि ये सिर्फ एक टेम्परेरी स्टेज होती है लाइफ में बच्चों की। तो वहाँ से मुझे लगा एक बार मुझे देखना चाहिए। फिर मैंने ऑनलाइन सेशंस लिए, थोड़ी हाइपरएक्टिविटी कम हुई, थोड़ी सी स्पीच भी डेवलप हुई। फिर उसके बाद हम लोगों ने फिजिकली ये जो चंडीगढ़ सेशन यहाँ पे जो इन लोगों का सेंटर है यहाँ हम लोग आए, वहाँ हम लोगों ने पूरा जो इनका पंचकर्म और सारे जो सेशंस होते हैं योगा, EVA क्लासेस सारी। तो अभी हमारा आज 4th डे है। 4th डे में मुझे काफ़ी अपना बच्चा रिलैक्स लग रहा है। इसमें काफ़ी अच्छे चेंजेस मुझे देखने को मिल रहे हैं। स्पीच भी जनरेट होना और अच्छे से स्टार्ट हो रही है, सेंटेंस भी उसे बुलवा रहे हैं, वो बोल रहे हैं। और यहाँ के जो सारे स्टाफ मेम्बर्स हैं वो काफ़ी सपोर्टिव हैं, बहुत अच्छे से सारी सेशंस और क्लासेस जो भी होती हैं सारी चीज़ें बहुत हेल्प कराते हैं। मेरा स्टे भी बहुत अच्छा है, तो मुझे यहाँ ओवरऑल सारी चीज़ें अच्छी लगी। मेरे बच्चे को भी काफ़ी